Dr. Sarah Martinez had seen enough blood for 3 lifetimes. After 12 years as a combat medic, first in Afghanistan, and then in Syria, her hands had stopped shaking when the mortars fell. Her heart had learned to beat steady when others screamed. But today, sitting in the medical tent at Forward Operating Base Phoenix, she felt something she hadn't experienced in years. Doubt. The letter from her sister lay crumpled on her cot. "Mom's getting worse, Sarah. The doctors say maybe 6 months. She keeps asking when you're coming home." Sarah stared at the words until they blurred. She had missed her father's funeral 2 years ago because of a mission that couldn't wait. She wouldn't miss saying goodbye to her mother. "Doc, we need you out here." Sergeant Williams burst through the tent flap, his face grim. Helicopter crash about 10 clicks north. Multiple casualties. Sarah's training kicked in before her mind could catch up. She grabbed her medical kit, the heavy bag that had become like an extension of her body. How many wounded? Unknown. Radio went dead after the Mayday call. Williams helped her load supplies into the rescue vehicle. "Command wants you on the ground in 20 minutes. The ride through the desert was brutal." The armored vehicle bounced over rocks and sand, throwing Sarah against the metal walls. She checked her supplies for the 100th time. Tourniquets, morphine, IV bags, surgical tools, everything a field medic needed to keep people alive until they could reach a proper hospital. When they arrived at the crash site, Sarah's stomach dropped. The helicopter lay twisted and smoking in a shallow valley. The metal bird that should have been soaring through the sky was now a broken shell scattered across the sand. Pieces of rotor blades stuck up from the ground like grave markers. "3 survivors," called out Lieutenant Jackson, who had arrived with the first response team. All Navy SEALs. The pilot didn't make it. Sarah ran toward the wreckage, her medical bag bouncing against her hip. The heat from the smoldering metal hit her face like opening an oven. She could hear groaning from somewhere inside the twisted cabin. The first SEAL she reached was conscious but trapped under a piece of the aircraft's frame. Blood soaked through his desert camouflage uniform, and his left leg was bent at an angle that made Sarah's trained eye immediately assess. Compound fracture. Possible internal bleeding. "Hey, Doc," he whispered, managing a weak smile despite the pain. "Looks like we're having a bad day. What's your name, soldier?" Sarah knelt beside him, her hands already working to assess his injuries. "Petty Officer Marcus Thompson. My buddies call me Tank." He winced as she touched his leg. "The other guys, are they?" "I'm going to take care of all of you," Sarah said firmly. "But first, I need to get this metal off you." Working with 2 other soldiers, they carefully lifted the twisted piece of aircraft frame. Tank bit down on a piece of cloth to keep from screaming as they moved him to a flat area away from the wreckage. The second SEAL was unconscious, buried partially under debris near what used to be the helicopter's tail section. Sarah could see his chest rising and falling, which meant he was breathing, but blood trickled from his ears. Head trauma. Possibly severe. "Help me dig him out, but carefully," she ordered. "If he has spinal injuries, moving him wrong could paralyze or kill him." They worked like archaeologists, removing each piece of metal and debris with precision. The SEAL's name tag read Morrison. He was young, maybe 25, with short blonde hair matted with blood and dust. Sarah checked his pulse and pupils. "Possible traumatic brain injury. We need to stabilize his neck before we move him." She fitted a cervical collar around Morrison's neck and directed the team to carefully place him on a backboard. The third SEAL was the hardest to reach. He had been thrown clear of the main wreckage but landed near a fuel leak that was slowly spreading across the sand. The acrid smell of aviation fuel mixed with the metallic scent of blood filled Sarah's nostrils. This SEAL was awake and trying to crawl away from the fuel spill, leaving a trail of blood behind him. "The fuel," he gasped when he saw Sarah approaching. "If it ignites." "What's your name?" Sarah asked, pulling on latex gloves as she assessed his injuries. "Chief Petty Officer David Chen. My back. I can't feel my legs." Sarah's heart sank. Spinal cord injury. In the field, with limited resources and the smell of fuel growing stronger, this was every medic's nightmare scenario. "Chen, I need you to stay completely still. Don't try to move at all." she signaled to the rescue team. "We need to get everyone away from this fuel leak, now." But moving 3 severely injured patients, especially one with potential spinal damage, would take time they might not have. The fuel was spreading faster now, creeping toward a small electrical fire that sparked occasionally from the helicopter's damaged systems. Sarah made a decision that went against every safety protocol she had ever learned. Instead of calling for additional support and waiting for specialized equipment, she began triaging the patients for immediate evacuation. "Tank, you're going first. You're stable enough to move fast." She administered morphine for his pain and directed 2 soldiers to carry him to the vehicles. Morrison was next. Still unconscious, he would need constant monitoring. But his breathing was stable. "Keep checking his pulse every 30 seconds, she told Sergeant Williams as they loaded him into the medical transport vehicle. Chen was the biggest problem. Moving a patient with a suspected spinal injury required specialized equipment they didn't have, and time they couldn't spare. The fuel smell was getting stronger, and Sarah could see vapor rising from the spreading puddle. "Doc, we need to go," one of the soldiers said, his voice tight with worry. "If that fuel catches..." Sarah looked at Chen, who was watching her with calm, intelligent eyes. He knew, as well as she did, what a fuel explosion would mean for all of them. "I'm not leaving him," she said simply. Working quickly but carefully, she fashioned an improvised spinal board from pieces of the helicopter's interior paneling. It wasn't perfect, but it would have to do. She talked Chen through every step as they prepared to move him. "I'm going to give you something for the pain, but I need you conscious in case your breathing changes," she explained, drawing morphine into a syringe. "Doc," Chen said quietly, "if something happens, tell my wife I was thinking about her." "You'll tell her yourself when we get you home," Sarah replied, but her hands were shaking slightly as she administered the pain medication. The evacuation was a nightmare of careful coordination and suppressed panic. Every movement had to be precise to avoid further injuring Chen's spine. But the spreading fuel forced them to work faster than was safe. Sarah stayed with Chen throughout the transfer, one hand monitoring his pulse, while the other held his makeshift spinal board steady. The vehicles were loaded and moving within minutes, but those minutes felt like hours with the constant threat of explosion behind them. As their convoy pulled away from the crash site, Sarah looked back to see a small flame finally reach the fuel spill. The explosion lit up the desert sky, sending a column of black smoke rising into the cloudless blue above. They had escaped with minutes to spare. The ride back to base was a frantic effort to keep 3 critically injured patients stable with limited resources. Sarah moved between the 3 SEALs, monitoring vital signs, adjusting IV drips, and making the split-second medical decisions that would determine whether these men lived or died. Tank's blood pressure was dropping despite the IV fluids. Internal bleeding was getting worse. Morrison's pupils were showing signs that the brain swelling was increasing. Chen had developed a fever, which could indicate infection or shock. "How long until we reach the base?" Sarah called to the driver. 10 minutes, Doc. 10 minutes to keep 3 lives hanging by threads." Sarah had done this countless times before, but something felt different about this mission. Maybe it was the letter from her sister still folded in her pocket. Maybe it was the thought of her dying mother. Or maybe it was the look in Chen's eyes when he asked her to tell his wife he was thinking about her. Whatever it was, Sarah knew this would be her last mission as a combat medic. After 12 years of saving lives in war zones, she was finally ready to go home. But first, she had to make sure these 3 brave men made it home too. The base appeared on the horizon like a mirage, its familiar outline promising the advanced medical facilities that could give Tank, Morrison, and Chen the care they desperately needed. Sarah had gotten them this far, but the real fight for their lives was just beginning. The base's emergency medical team was waiting when they arrived. Sarah had radioed ahead with the casualties' conditions, and the trauma bay was already prepared for multiple critical patients. But as they wheeled the 3 SEALs through the doors of the medical facility, Sarah realized their problems were far from over. "We're getting reports of incoming wounded from 3 other locations," Dr. Peterson, the base's chief medical officer, told Sarah as they worked to stabilize Tank on the operating table. "There's been coordinated attacks across the region. We're looking at maybe 20 casualties in the next 2 hours. Sarah felt her stomach tighten. 20 casualties meant the medical staff would be stretched beyond their limits. With only 2 operating rooms and a limited number of doctors, some difficult decisions would have to be made about who received immediate care and who would have to wait. Tank's internal bleeding was worse than Sarah had initially thought. His blood pressure had dropped dangerously low during transport, and he was going into shock. "He needs surgery now," she told Dr. Peterson. "I think there's damage to his spleen or liver." "Take OR1, Peterson replied without hesitation. "I'll handle Morrison's brain surgery in OR2. That leaves Chen." Sarah looked across the trauma bay to where Chen lay on a gurney, still conscious but pale and running a fever. His spine injury required delicate surgery that could take hours, surgery they might not have time for if more critical casualties arrived. "Chen can wait," Chen said weakly from his gurney, apparently overhearing their conversation. "Take care of the others first." Sarah walked over to him, checking his vital signs. His fever was getting higher, and she could see pain in his eyes despite the morphine. "That's not your decision to make, Chief." "Yes, it is," he replied with the kind of quiet authority that had made him a leader among the SEALs. "I've been in the Navy for 15 years. I know what triage means." Sarah knew he was right from a medical standpoint. Tank and Morrison both had immediately life-threatening injuries, while Chen's condition, though serious, was stable for now. But something inside her rebelled against the cold mathematics of battlefield medicine. "Your wife wouldn't agree with you," Sarah said, adjusting his IV drip. Chen smiled slightly. "My wife married a SEAL. She knew the deal when she signed up. The next 6 hours were a blur of surgery, exhaustion, and split-second decisions." Sarah operated on Tank, removing his damaged spleen and repairing internal bleeding, while Dr. Peterson worked to reduce the swelling in Morrison's brain. Both surgeries were successful, but barely. Tank flatlined twice on the operating table before Sarah managed to stabilize him. Morrison's brain pressure had been so high that another 30 minutes delay might have caused permanent brain damage or death. While they worked, the base continued to receive wounded soldiers from the coordinated attacks across the region. The medical bay filled with groaning men and women, some with minor injuries, others fighting for their lives. Sarah moved between patients like a machine, suturing wounds, setting broken bones, and making the terrible decisions about who needed immediate care and who could wait. Her hands moved with practiced efficiency. But her mind kept drifting to Chen, still waiting on his gurney for spinal surgery. "Doc, you need to take a break," Nurse Janet Rodriguez said during a brief lull between casualties. "You've been on your feet for 18 hours straight." Sarah looked around the medical bay. Tank and Morrison were stable in the intensive care unit. Chen was still waiting. His condition unchanged, but not improving. 12 other patients were being treated for various injuries ranging from shrapnel wounds to broken bones. "How many more wounded are coming in?" Sarah asked. "The attacks have stopped. This might be the last wave," Rodriguez replied. Sarah nodded and walked over to Chen's gurney. He was awake, talking quietly with one of the other wounded soldiers. When he saw her approaching, he smiled. "How are my buddies doing, Doc?" "Tank's spleen was damaged, but we got the bleeding stopped. He'll be fine." Morrison had some brain swelling, but Dr. Peterson was able to reduce it. "He's unconscious but stable." Chen closed his eyes with relief. "Thank you." Sarah checked his chart. His fever had stabilized, but he was still showing no feeling in his legs. The longer they waited to operate on his spine, the less likely it became that he would ever walk again. "Chen, we need to talk about your surgery," Sarah began. "I know what you're going to say, Doc. The longer we wait, the worse my chances get." Sarah sat down beside his gurney, something she rarely did during a crisis. "I want to operate on you tonight. Dr. Peterson can assist. But I need you to understand the risks." Chen turned his head to look at her directly. "What kind of risks?" "Spinal surgery is always dangerous, especially under these conditions. There's a chance the surgery could make your paralysis permanent. Even if there was originally hope for recovery, there's also a risk of infection, bleeding, or other complications." Chen was quiet for a long moment, staring at the ceiling of the medical tent. Around them, the sounds of wounded soldiers and busy medical staff created a constant background noise. "Doc, can I ask you something?" "Of course. How long have you been doing this? Saving people in places like this?" Sarah was surprised by the question. 12 years. You ever lose someone you thought you could save? The question hit Sarah harder than she expected. Images flashed through her mind. The young Marine who bled out in her arms in Afghanistan. The Iraqi interpreter who died from an IED blast while she worked frantically to save him. The helicopter pilot from today's crash who was already gone when they arrived. "Yes," she said simply. "But you keep doing it anyway." "Until now, yes." The words came out before Sarah could stop them. Chen raised an eyebrow. "Until now?" Sarah found herself telling him about the letter from her sister, about her dying mother, about the decision she had made to leave the military and go home. She wasn't sure why she was sharing this with a patient, but something about Chen's calm presence made her want to talk. "My mom raised me and my sister alone after my dad died when I was 16, Sarah explained. "She worked 2 jobs to put me through college. When I told her I was going to be a combat medic, she said she was proud of me but terrified at the same time." "Sounds like a good mom," Chen said. "She is. And I've missed too much time with her already." Chen nodded slowly. "Doc, let me tell you something. I've got a wife and 2 kids back home. My daughter just turned 8. And my son is 5. I've missed 3 of their birthdays, 2 Christmases, and their first days of school." Sarah waited for him to continue. "But every person you save out here has a family too. Tank's got a pregnant wife waiting for him. Morrison's got parents who still think he's their little boy. When you save us, you're saving all the people who love us too." Sarah felt tears starting to form in her eyes, something that hadn't happened in years of combat medicine. "Your mom will understand if you stay," Chen continued. "And if you go, that's okay too. But don't let guilt make the decision for you." Before Sarah could respond, alarms started blaring throughout the medical facility. A voice came over the intercom. "All medical personnel to emergency stations. Multiple casualties incoming from IED attack. ETA 5 minutes. Sarah stood up immediately, her training overriding her exhaustion. "Chen, I have to." "Go, Doc. Save some lives." The next 2 hours brought a new wave of casualties from an improvised explosive device that had hit a convoy returning to base. Sarah worked alongside the other medical staff, treating everything from minor cuts to traumatic amputations. One of the casualties was a young soldier, barely 19 years old, who had been riding in the vehicle closest to the explosion. Both of his legs were severely damaged, and he was unconscious from blood loss. As Sarah worked to stabilize him, she couldn't help but think about what Chen had said about families. This boy probably had parents at home, maybe siblings, friends who cared about him. Her decision to save his life would ripple out to touch all those people. The surgery took 3 hours. When it was over, the young soldier's legs were saved, though he would need months of rehabilitation. But he was alive, and he would go home to his family. As dawn broke over the base, Sarah finally had a chance to rest. The immediate crisis was over, but Chen was still waiting for his spinal surgery. She found him in the same place she had left him, talking with another patient and somehow managing to keep everyone's spirits up despite his own condition. "Ready for that surgery, Chief?" Sarah asked. Chen smiled. "Been ready all night, Doc." "Let's do this." As they prepared Chen for surgery, Sarah made a decision that surprised even her. She wasn't ready to leave the military yet. Her mother would have to understand that there were still lives to save, still families to keep together. But first, she had to make sure Chen could walk back to his own family when this was all over. The surgery would be the most challenging of her career, requiring every skill she had learned in 12 years of combat medicine. As they wheeled Chen into the operating room, Sarah felt the familiar calm that came with knowing exactly what she had to do. Her hands were steady, her mind was clear, and her purpose was absolutely certain. She was going to save this man's life, just like she had saved Tank and Morrison. Because that's what medics do. And that's who she was. The spinal surgery began at 6 in the morning, with desert sunlight streaming through the small windows of the operating room. Sarah had performed hundreds of surgeries during her military career, but none as delicate as this one. Chen's spinal cord showed compression at the L2 vertebra, where a bone fragment from the helicopter crash had lodged dangerously close to the nerve bundle that controlled his legs. Dr. Peterson assisted as Sarah made the initial incision along Chen's lower back. Every movement had to be precise. One wrong cut, one slip of the scalpel, and Chen would never walk again. Pressures stable, reported the anesthesiologist. Heart rate normal. Sarah worked methodically, exposing the damaged vertebra and the bone fragment that was compressing Chen's spinal cord. The fragment was larger than the X-rays had shown, wedged tightly against the nerve tissue. "This is going to be tricky," she murmured to Peterson. "The fragment has sharp edges. If it shifts during removal." "You've got this, Martinez," Peterson replied quietly. "I've watched you save lives that other doctors would have given up on." Sarah began the delicate process of removing the bone fragment. Using microsurgical instruments, she carefully separated the fragment from the surrounding nerve tissue. Each movement was measured in millimeters. One wrong move could sever the nerves permanently. Halfway through the procedure, Chen's blood pressure began to drop. "He's going into shock," the anesthesiologist announced. "Stay with me, Chen," Sarah said, even though he couldn't hear her under anesthesia. She increased the pace of her work while maintaining the same surgical precision. The bone fragment finally came free after 45 minutes of careful manipulation. Sarah examined the exposed spinal cord under the surgical microscope, looking for signs of permanent damage. "How does it look?" Peterson asked. Sarah studied the nerve tissue carefully. There was swelling and bruising, but the actual nerve fibers appeared intact. "I think we got it in time. The nerves look viable." The rest of the surgery involved cleaning the area, checking for any remaining bone fragments, and carefully closing the incision. By the time they finished, 3 hours had passed. As they wheeled Chen to the recovery room, Sarah felt the exhaustion of the past 24 hours finally catching up with her. But she stayed by his bedside, monitoring his vital signs as he slowly emerged from anesthesia. "Doc?" Chen's voice was groggy from the medication. "I'm here, Chief. How are you feeling?" "Like I got hit by a helicopter," he said with a weak smile. "Did you? Can I?" Sarah understood what he was asking. "We won't know about your legs for a while. The swelling needs to go down first." "But Chen, I think the surgery went well." Over the next few days, Sarah watched all 3 SEALs begin their recovery. Tank's internal injuries healed rapidly, and he was soon joking with the nurses about the hospital food. Morrison regained consciousness after 36 hours, with no apparent cognitive damage from his brain injury. Chen's recovery was slower and more uncertain. The swelling in his spine gradually decreased, but he still had no feeling in his legs after a week. Sarah checked on him multiple times each day, adjusting his medication and monitoring for any signs of sensation returning. "Doc, you don't have to keep babysitting me," Chen said during one of her visits. "I know you've got other patients." "Actually, I don't," Sarah replied. "The base has been quiet for the past few days. No new casualties." Chen studied her face. "You're worried about my legs." Sarah sat down in the chair beside his bed. "I am. But more than that, I'm worried about something else." "What's that?" "I keep thinking about what you said, about saving families along with patients, about my mother." Chen shifted position carefully in his bed. "You talked to your sister?" Sarah nodded. "Last night. My mom's condition is getting worse. The doctors think she has maybe 3 months now, not 6. And you feel guilty about not being there." "I do. But I also feel like I can't leave, knowing that there are people here who might need me. People like you, and Tank, and Morrison." Chen was quiet for a moment. "Doc, can I tell you something about being a SEAL?" "Sure. We train for years to make split-second decisions in life or death situations, but the hardest decisions aren't usually about combat tactics or mission objectives. They're about the people we love and the people we serve." Sarah listened as Chen continued. 3 years ago, I missed my daughter's birthday because of a mission in Iraq. She was turning 5, and she had specifically asked for Daddy to be there. But 12 hostages were being held by terrorists, and our team was the only one positioned to rescue them. What did you do? I went on the mission. We saved 11 of the 12 hostages. One died before we could reach him. Chen's voice was soft with emotion. When I called my daughter to apologize for missing her birthday, you know what she said? Sarah shook her head. She said, "That's okay, Daddy. You were helping people who needed you more than I did." She was 5 years old, and she understood something that took me years to figure out. Which was what? That sometimes loving people means making sacrifices for other people too. Your mom raised a daughter who saves lives. She'll understand if you need to stay. Understand. That evening, Sarah called her sister again. Their conversation lasted 2 hours, covering everything from childhood memories to their mother's current condition, to Sarah's dilemma about staying in the military. "Sarah," her sister said finally, "Mom and I have talked about this. She's proud of what you do. If you came home now just because she's sick, she'd spend her last months feeling guilty about taking you away from your work. But I want to be there for her. You can be there for her in different ways. Every time you save someone's life, you're honoring the values she taught you." Honoring. Sarah hung up the phone, feeling both relief and sadness. She knew her sister was right. But the thought of missing her mother's final months was almost unbearable. The next morning brought unexpected news about Chen. When Sarah arrived for her morning rounds, she found him sitting up in bed with an expression of amazement on his face. "Doc, you need to see this," he said excitedly. Chen pulled back the blanket covering his legs. Sarah watched as he slowly flexed his right foot. Then his left foot. "When did this start?" Sarah asked, trying to contain her excitement. "About an hour ago. First just tingles, then actual movement." Chen grinned broadly. "Doc, I think you might have saved my career, along with my life." Sarah felt tears of relief and joy running down her cheeks. After 12 years of combat medicine, she still got emotional when a risky surgery succeeded. "The sensation will probably come back gradually," she explained. "You'll need months of physical therapy. But Chen, this is incredible news." Over the following weeks, Chen's recovery accelerated dramatically. Feeling returned to both legs, and he progressed from bed rest to walking with assistance to taking his first independent steps. Tank and Morrison had already been transferred to a military hospital in Germany for further treatment and recovery. Sarah's unit was scheduled to return home in 6 weeks, which meant her military service was almost over. She had decided not to re-enlist, but for reasons different from her original plan. "I'm going home to be with my mother," she told Chen during one of their final conversations before his medical evacuation. "But afterward, I'm coming back, not as a military medic, but with one of the medical aid organizations." Chen nodded approvingly. "That sounds right, Doc. Your mom gets her time with you, and you get to keep saving lives. It was something you said about families. When I save you guys, I'm not just saving you. I'm saving your wives, your kids, your parents, all the people who love you. You figured out the secret, Doc." "What secret?" "That love isn't about keeping people close to you. It's about helping them do what they're meant to do." Sarah's mother died peacefully 8 months later, with Sarah holding her hand. They had spent 3 wonderful months together, during which Sarah helped care for her, and they talked through decades of shared memories. At the funeral, Sarah's sister gave a eulogy that mentioned their mother's pride in having a daughter who dedicated her life to saving others, even when it meant personal sacrifice. 6 months after the funeral, Sarah was back in a combat zone, this time working with Doctors Without Borders in a refugee camp. The conditions were different, but the work was the same: saving lives, healing families, giving hope to people in desperate situations. She often thought about Tank, Morrison, and Chen. Tank had made a full recovery and returned to active duty. Morrison had some lingering effects from his brain injury but was alive and back with his family. Chen had not only recovered the use of his legs but had been promoted and was training new SEALs. Each of them had written to thank her, but Sarah knew the truth. They had saved her as much as she had saved them. They had helped her understand that her calling as a healer was bigger than any single decision or sacrifice. Late one evening, while treating patients in the refugee camp, Sarah received an unexpected visitor. Chen appeared at the medical tent, dressed in civilian clothes and carrying a small wrapped package. "Chief Chen, what are you doing here?" Sarah couldn't hide her surprise and delight. "I'm on leave, and I wanted to deliver this personally," he said, handing her the package. "It's from Tank, Morrison, and me." Sarah opened the package to find a simple silver pendant engraved with the words, "To families everywhere, from the families of Tank, Morrison, and Chen. We wanted you to know," Chen said, "that you didn't just save our lives, you saved our families' lives too." Tank's daughter was born 3 months ago. Morrison walked his sister down the aisle at her wedding last month. My son just started Little League, and I was there for his first game. Sarah felt the familiar tears that seemed to come more easily these days. "But more than that," Chen continued, "you taught us something about service and sacrifice. About how loving people sometimes means making hard choices." Sarah looked around the medical tent at the refugee families she was treating. Children with malnutrition, mothers with complications from childbirth, fathers with injuries from the violence they had fled. "I'm exactly where I'm supposed to be," Sarah said. Chen smiled. "I know you are, Doc. That's why we're not the only ones you saved. Every life you touch, every family you keep together. That's all connected to that day, when you decided not to leave us behind." As Chen prepared to leave, Sarah thought about the long chain of decisions that had brought her to this moment. Her choice to become a medic, her decision to serve in combat zones, her struggle between duty and family, and ultimately her understanding that the two were not opposites but part of the same calling. "Chen," she called as he reached the tent entrance. "Yes, Doc? Thank you for helping me figure out who I really am." Chen nodded. "Thank you for showing us what a real hero looks like." After he left, Sarah returned to her patients. There was work to do, lives to save, families to heal, and for the first time in her career, she knew with absolute certainty that she was exactly where she belonged. The medic who had seemed done with military service had discovered that her real mission was just beginning. She would spend the rest of her life saving people in places